Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about another form of callus, or another presentation of callus that can happen on the foot. And this one actually happens on the heel. It's called Hyperkeratosis Calcaneum Marginatum, and it's basically about the margins of the heel. So I don't have a model with skin on it, but it would basically go right around the heel in this area. And typically the way it presents is it's really thick callus. It can get really dry in that area. It can also crack, and a lot of times it will be pretty sore because you'll get cracks and cause pretty good discomfort. This is very common in areas that are quite dry, like Utah, especially in women that either don't wear shoes or they have a tendency to wear sandals or shoes without backs on them, so they're constantly having the moisture pulled away from their foot throughout the whole day. There are individuals that it's a bigger problem for, and individuals where it's not as much of a problem, but really it can get to the point where it gets really tender and painful. So what are the options? As with any other calluses, you can trim them down and keep them smoothed down. A lot of times as a individual, you can do this in the shower using like a pumice stone, and you just rub it down. But the truth is, the real problem is not the callus, it's the dryness of the skin. And so the best thing to do is to use some kind of a lotion. The disadvantage of most lotions, if you don't use them 3 to 4 times a day, which nobody does, they're not going to work really well on an area like this that gets so dry. So you're looking for lotions that you can say, okay, these are designed to be used once or twice a day, as opposed to even more than that. Our lotions. Sween 24 is one that we found that actually works. Udder balm sometimes will work, although I do recommend you use that twice a day, morning and night. The idea, some of these types of lotions though will get pretty greasy, and if you're putting them out right before bed, you may have to wear socks or something similar. So if you have a really dry heel and you have a problem with this, it's worth getting evaluated to see, is there anything that we can do for this? Are there any options? And if you're consistent in treating it, you can usually help the dryness, you can usually help recover, and because of that, you get to the point where this is no longer a problem and you're not worried about it cracking and hurting and having issues that way. So, of course, the other option is you put socks on and you wear socks inside shoes. This will be less of a problem that way as well, although most people don't take that option. This is Dr. Brandt Gibson, and this is your podiatry tips